Hello everyone, welcome. Today I'm going to discuss about the surface tension and the importance of surfactant in lungs. So the surface tension of the alveoli is actually the result of the attractive forces between the molecules lining the alveoli. So those are the liquid molecules. Suppose you have an alveoli here and you have a liquid layer inside the alveoli, and the attraction between them actually tries to collapse the alveoli, and this collapsing force is actually the surface tension mainly. And this surface tension, as I've already mentioned, it creates a collapsing pressure, and this collapsing pressure is actually can be identified by this equation. This is called Laplace law. So this is the collapsing pressure on the alveolus, or this is the pressure required to keep alveolus open, and this pressure is actually proportional to the surface tension, 2 times the surface tension actually, and it is inversely proportional to the radius of the alveolus, stating that if a alveolus is large, it will have a lower collapsing pressure, and if an alveolus is small, it will have a higher collapsing pressure. So here, as you can see, that large alveoli which have a large radius have a low collapsing pressure, and that's why they are very easy to keep open, and the small alveoli which have a small radii have high collapsing pressure and are more difficult to keep open, and that's why you need surfactant. And in the absence of surfactant, the small alveoli have a tendency to collapse, which is also called atelectasis. So here is a graphical representation of this concept. You have a large alveolus, a small alveolus, and a small alveolus with surfactant. In the large alveolus, as the radius is actually very high, and that's why this creates a very low collapsing pressure. So the collapsing pressure is low due to high radius and ultimately a decreased tendency to collapse. So you can say that the large radius is keeping the alveolus open, and in the small alveolus, as the radius is small, the pressure is higher and there is an increased tendency to collapse. So what you can do to prevent this tendency to collapse? What you can do is you can line the alveolus with surfactant. So surfactant will actually reduce the attractive forces between the molecules lining the alveoli, and that's why it will reduce the surface tension, and as the surface tension is proportional to the collapsing pressure, it will reduce the collapsing pressure, and ultimately there will be a decreased tendency to collapse. So what is surface tension? So those are the chemical substances that reduce surface tension by disrupting the intermolecular forces between the liquid molecules, and this actually prevent collapse and increases the compliance or increases the distensibility of the alveoli. Surfactant is actually synthesized by the type 2 pneumocytes, and it mainly contains the phospholipid called dipalmitoyl phosphatidylcholine. And in the fetus, commonly surfactant is present within 24 weeks, and it's almost always present and matured at about 35 weeks. And generally, a lecithin sphingomyelin ratio greater than 2:1 in amniotic fluid reflects mature levels of surfactant. So what is neonatal respiratory distress syndrome? It is a syndrome that occurs in premature infant, and it occurs due to a lack of surfactant. And whenever there is a lack of surfactant, there will be atelectasis, especially of the smaller airways, and the lungs will collapse, and you cannot easily reinflate the lungs because there is decreased compliance due to increasing collapsing pressure, and it will lead to hypoxemia as a result of decreased VQ. As there is lung collapse or atelectasis, the volume of the air in the lungs is actually decreased. So the volume of air available for ventilation is decreased, and that's why it will lead to a abnormal VQ ratio and ultimately leads to hypoxemia. So that's all about the case. And now we have the practice problem. So suppose a professor creates a model to teach respiratory physiology to her students. In her model, 2 spheres with elastic properties similar to alveoli are connected as shown below, with a clamp position between them preventing airflow. So you have a large one here and a small one here, and here is a controller valve. The surface tension within the 2 elastic spheres is identical, and neither is lined with the surfactant. Which of the following options best describes what will happen when the clamp is opened? So pause for a moment, pick your answer, and my answer will be the smaller sphere will collapse, because the question mentioned that this smaller sphere does not have surfactant, And as the smaller sphere has a low radius, the collapsing pressure of the P will be high. So it will be the first one which will be easily collapsed when the valve is opened. And the air from here will actually go or flow to this region. So this one will collapse. So that's all from me today. Thanks all for watching my video.